assist the government in flattening the curve. So basically half my time is spent reviewing calls and concerns from communities and people, along with the peace officers. We go out and do face-to-face education. So that's kind of what I'm doing. I don't know where you want to start with, Renee. Do you want me to work through some of these questions you sent me, or?
Yeah, sure, do that, and then we can kind of field questions as we go. And
okay, so I'll start with the questions that Renee has sent me. We are having a few of these, generally speaking, anyway. So I'll read the question and then I'll give the best I can answer for it. People are struggling with how to negotiate rental spaces. For example, when neighbours are gathering in hallways, having people over, what can people do to either report or influence this situation? Landlords are not responsive. This person lives in a high rise. The husband and I are just waiting for the virus to take over the building. And basically they've been told by one of the people that works in the building that should it take over, the building's going to be shut down and everyone's going to be isolated. Can they do that? If someone in the building gets sick, they don't have to. How can we get food? So rentals are coming up quite frequently. Our basic advice is you've also got the resources out there to deal with these. So you've got the Landlord and Tenant Advisory Board as well. The Alberta website has some great posters, and they have them for all sorts of things, for putting up if you're self-isolating, for physical distancing, elevator etiquette and everything else. The kind of short answer is, yes, social distancing should be taking place, and you should be doing your best to that. I would suggest that if the landlord's not on board or not wanting to do anything, maybe print off some of these posters and just let the landlord know that, or ask the landlord if they have any issues with you just putting some education posters up around the building. In relation to should someone get sick in the building, that's pretty much dealt with through Alberta Health Services. But if someone is sick and they do test positive, then the Alberta Health Services will do their regulatory checks on who they've come into contact with. And it may well be that they require people to self-isolate until they are tested or tested negative. It's not a total shutdown of the building, but it is designed for protecting everyone's health and wellness during this. And they will direct people as to what needs to be done. If it's just a case of someone's having symptoms, then obviously 811 is the way to go. If you're having symptoms, it's 811 as well. And they will direct you through the health questioning. You can do the online assessments. The tools that Alberta Health Services have put out there, I know not everyone has internet access, but the tools that are out there are amazing. So that's pretty much, I think that pretty much covers that one. There are some volunteer organisations and there are some apps out there where if you can't get out because you're self-isolating and you need shopping and you can do the online shopping, or if not, there are some volunteers that are out there that will help out. But just bear in mind with those kind of things, if you're self-isolating, you shouldn't be answering the door and talking to the people. It should all be done through a closed door. So the next question, this comes up a lot, and I actually got some clarification on this, which is probably quite helpful as well, is driving. So the first one is, what are the restrictions on travelling? The guidelines by Alberta Health Services on travelling is avoid all non-essential travel. It's as simple as that. I think it's fairly common sense in the respect of, if you don't need to go somewhere, then just don't go there. If you need to go out, like with the shopping guidelines, if you need to go shopping, you can go shopping. They recommend one person per family because that assists with the social distancing in stores. And a lot of stores are limiting people. So clearly if there's 70 people allowed in a store and two to four people of a family go to do the family shopping, you're preventing 3 other people or 3 other families doing their shopping. So just a bit of courtesy with that. But yeah, the guideline is just no non-essential travel. Are people ticketing for driving, and if so, why? I'm presuming this question means, are you people being ticketed for driving with people in the car. So again, we're looking very much at education. To my knowledge, there's been quite a few stops, but very few tickets. With the driving, you can, if you're the same family living in the same household, then you can travel in a car together. If you are carpooling for work purposes and you both work in the same place, you can travel together. I know some companies, and this is a suggestion with the company, they are issuing letters to say that a person works at X company and is still required to work at that location. And if all the workers in a car carrying the letters, that covers the issue. The issue comes when you may be stopped and you can't prove that you're carpooling for work purposes. And another part of this question was someone, they live together, but the addresses on the licenses are different. In that case, I would recommend you take with you some sort of, or the person with the incorrect address, take some sort of proof like a bill or something with their name and that address on it, and that will show that you live together. As everyone should know, this is all designed to prevent the spread of the virus, and that's what all these health acts are in place for. So our purpose first is education. So it will be an education first program that we're running. Having said that, these health acts have been in place for nearly a month now. So we're hoping that most people have a good idea of what they can and can't do. Next one was businesses. What do we see if a business is open that shouldn't be? Right now, Alberta Health Services are dealing with businesses and businesses that are breaching the acts. So if you do see one that's open, just report it to Alberta Health Services. They've got an online reporting system that you can go to. Will there be consequences for people who waste time and resources by calling in petty issues? Kind of a difficult one to answer because it kind of depends what petty is. But we do look at all the calls that come in. We do look at them. We do some research on them, and we do call people as to the validity. If there are any blatant, I guess, petty issues, if you want to put it that way, they will be investigated. That's pretty much all I can say, really, because each incident has its own background. Disabilities. As a person with severe hearing loss, I experience great difficulty communicating in person and often have to come closer to those speaking with me. Obviously, this may cause issues in day-to-day police interaction. Now that COVID is an issue and distancing, how will my or other individuals with hearing loss be accommodated by EPS in this time of COVID? There's a kind of a few things here. Firstly, if you're calling in to the police for any kind of police matter, when you're talking to the dispatcher, then tell them that you have hearing loss and maybe what degree it is. Our members have got quite strict policies and procedures in place for meeting people. So we're trying to keep the social distancing. However, should police officers need to go within that social distancing circle, we have our protective equipment with us. They have masks, glasses, gloves, so they can protect themselves if need be, if that is the issue. If it's not a call for service, but you happen to just, for some reason, come across a police officer or are dealing with one, then all you can do is your best to communicate to them that you have a hearing loss, and they will make that judgment on the street as to whether they need to put anything protective on. They have a list of questions they ask people before coming in contact with people. And hopefully that should alleviate any issues around that. And the last one here that I was going to answer, I pretty much just have, was about the protection for police. Like I said, we have our all our policies and procedures in place for sanitizing vehicles, ourselves, our protective equipment, the masks, the gloves, the glasses. We have a series of questions we ask people if we need to actually come in contact with them. We do a lot more via the phone than probably we did before. We have procedures if we have to need to interview people, and pretty much all our day-to-day business has been covered to keep our members and the public safe from this.
Perfect. We do have a couple of questions already coming up, Paul. First thing I'll just point out is Connie mentions for the 811 calls, just for people to make sure you do that self-assessment online at covid.ab.ca or whatever /COVID, and not to call 811 right away unless you've done that self-assessment, because there is quite a backup there, I know. So the questions that we do have, Paul, are kind of bigger questions, and I'll pose them together. There's two that kind of align. So the first question is, what extraordinary powers have been allocated to the police that have been as a result or justified by the pandemic? And kind of a follow-up question to that is, what research-based evidence does EPS have that supports the idea that fines, tickets, and threats of criminal punishment ensure people will follow public health orders? That's a pretty big one. So it's like the extraordinary powers, and then why fines? But I know that's a provincial decision. So I'll just pass those questions on to you.
Yeah, in relation to the first part, they're not so much extraordinary aspects. They invoke the Public Health Act, which then gave the powers under that act to peace officers and police officers, and they're in relation to breaches of those particular health orders. So it's the self-isolation, the mass gathering, and social distancing are the three main ones. The mass gatherings, as people know, is no more than 15 people. The social distancing is the 2 meters, 6 foot, or a hockey stick, whichever way you understand it best. And then the businesses, like I say, are being dealt with by Alberta Health Services anyway under that act. In relation to the evidence, there's not much difference between all the other day-to-day policing pre-COVID in relation to tickets and that kind of evidence around that. All I can say is our direction is education. It's education first. There are certain resources we use as well to make sure that education gets over to certain communities. We have the Alberta website has all the, I think they've got the posters that are out there in 13 different languages. We've already worked with a couple of translators to educate people. The ticketing will be a last option. And I can't, each one's going to be on its own merits. But it's certainly, people shouldn't be thinking that the police's first course of action is enforcement. In this instance, enforcement will be our last course of action.
Okay. Awesome. I'm just going to kind of pick up on that, and feel free, folks, if you have a question to type. I know we've got one there, but the one piece of the question that was standing out to me about the 15 people gathering is one thing that we've been seeing a lot on the group online is, you know, when people are in a basement suite, for example, there's an example of a basement suite, and the renters upstairs, the renters downstairs, and the renters downstairs were having well more than 15 people come in. Is that a situation where they should call EPS, or should they go up?
Yeah, we've had a few of those. The good thing about the team that we've built is whether you phone the non-emergency line or 311, those calls will come to our team to look at. I can't kind of stress enough that if people have the access to it, is to watch the daily updates. I think they're normally around 3:30 in relation to guidance, because there's a difference between the acts and guidance.
Mm-hmm.
They're recommending that people stick to families within the household. However, the guidance is, if you've got, say, for instance, if you have a couple of people over, a couple of families over, the social distancing becomes the issue. If you can't keep the social distance of 2 meters within your apartment, then there's the breach of the social distancing, which then the education comes in. With over 15 right now, Alberta Health Services are dealing with the over 15s, but we will still do the education and talk to people and ask them or explain to them the reasons why that all these acts are being put in place. I hope that covers it.
Okay, yeah, that's good. So next question we have from Sam. What is the instruction for police in regards to people who are out in public because they don't have a house to go to? So what's that engagement, or what's that instruction in relation to those without a home?
Sorry, just repeat that, Renee.
So what is the instruction for police in regards to people who are out in public because they don't have a house to go to?
The city got the centres like the Expo all set up, and we have members and peace officers and the resources in those areas. I can't really comment too much on what's happening with those, because that doesn't come under what I'm doing.
Okay. The next one is, we're getting them coming now. When the EPS is doing the education work on public health, traffic stops, etc., what happens to the information that is shown as proof that the people are living together or as a family unit? For example, is this information collected as in the case of carding or street checks, I guess it would be related to. So is that data kept and filed somewhere? What happens with that data is the question.
If they're just being stopped in a car and asked, and they prove they're either carpooling for work or they live in the same address, can't imagine that the information will be taken. It certainly won't be put into any kind of report because there's no offence.
Mm-hmm. Okay. And then just to follow up on that last one, I think Rob's asking with the homeless community. Is there somebody specifically that could answer that question they're asking? Like, who could they find out a little bit more information about EPS's engagement with those on the streets right now? We can come back.
Yeah, I'd probably have to let you know, Renee. I'd have to find out.
Sounds good.
I don't know who's dealing with it higher up. I know a couple of the sergeants, but I don't know who's controlling.
Yeah. Okay. Okay, we have another couple here. So Sarah says, my grandma takes me shopping once a week. I have autism and MS and don't drive, and I'm on a special diet. We don't live in the same house. However, this is a necessary trip. Could either of us end up with a ticket due to COVID? And how would we fight it if necessary, since it's to accommodate her needs?
That's a good one. I could do it, the first one. If they get a ticket, you fight it just by, you would do any other traffic ticket. You would just put in a not guilty plea and you'd attend the court as and when courts get back up and running. Yeah, again, I think the best thing for that, I don't really know the answer to that one. I'll take a note of it and I can get back to you on that one.
Sounds good. Okay. Okay, the next one, we'll just kind of keep working through these and then that's right. So what are the current procedures or directives that EPS is doing for education enforcement in public spaces and parks? So for example, with the nice weather, we're seeing large numbers of people in city green spaces, kids going out on the play parks, even though they're kind of blocked off. Are there any specific directives or procedures for EPS around those pieces?
No, not so much for EPS, because that kind of falls under the peace officers and the city. However, what we are doing, our team, we collect all the information that comes in either through EPS or 311, and we are mapping those locations, and then we are sending out either our members or the peace officers to assess the locations first to see if there is an issue. Mm-hmm. And if there is, then they will do education there. So they will be there to do the education. We've had a few with stairs, people using stairs for running. They've done some education around one of them, and now they've found that although people are still using them, people are waiting at the bottom until the person finishes what they're doing, then they're doing their bit, etc., etc. So people are getting the message, but that's how we're doing. We will hotspot them and deal with the most prevalent ones through education, mostly through the peace officer program.
Okay, that's awesome. This kind of builds off that question. Is it okay to go in bicycles as a family to entertain kids and exercise?
Yeah, if you're the same family and you're going, it's no different to going out for a walk. You can go out for a walk as a family. That's fine. Again, the whole premise around those kind of things is just make sure you keep your social distancing with other people that are sharing trails and parks. Mm-hmm. I had the same question in relation to motorcycles. When we talk about cars, motorcycles are the same. If you're in the same household, you can go on the back of a motorbike. If you're not in the same household, you can't.
Okay, and so this one we kind of talked about a little bit earlier, and I think it's a little bit of a different twig, but it's a question that comes up a lot. And it's about the driving. So are you allowed to drive around with a friend just to get out of the house, to go pick up food, go to the drive-through together, or whatever? So it kind of comes back to the initial question, but I don't know if you have any other thoughts on that. Are you allowed to drive around with a friend to get out of the house?
No, the rules are you either have to be traveling to and from the same place of work or live in the same house. However, it doesn't stop if you and a friend have a car and you go and get in your own car and get, let's say, a coffee and sit in a parking lot with your cars more than 2 meters apart to talk, then you're still adhering to social distancing.
Mm-hmm. Okay. So Barb says, it sounds like there's a lot of discretion left to the police to determine on a case-by-case basis how to respond to individuals out and about. So it sounds like there's a lot of discretion there, and you're taking that education approach. How are the police making sure that marginalized communities who are often made more visible due to, for example, lack of access to safe housing, are not being disproportionately impacted by these measures? Kind of builds off that question around engagement with housing, but I don't know if you have any thoughts on that one. How are police making sure that marginalized communities are not being disproportionately impacted by these measures?
Yeah, I'm not entirely sure. There is no different to, in some respects, it's no different to the discretion any law enforcement has on a day-to-day basis. And like I said, I can find out who's dealing with the marginalized communities, but we're not seeing anything, or I'm not seeing anything that would say that they're being treated any differently.
Okay. And the next one this is an interesting, kind of goes back to the gathering questions. I'm not sure if this has been asked already. Is there a reporting procedure if you come across someone on a Facebook group, for example, planning a group activity that affects social distancing? So say you're seeing people planning stuff online. Is there a procedure to report those things?
Yeah, we've had a few of those already. They've either come in through, like I say, through 311, or they've come in through our non-emergency line. And we've even had some that come in through the online AHS complaints. Okay. And that's the good thing about this. We're all talking to each other, so we don't duplicate our work.
That's perfect. Okay. And Robin just says, thank you. I'm the president of Oliver Community League, and we've received a lot of community feedback that distance isn't being respected in green spaces and stairs. I think education opportunities exist in most major spaces. Then Nexima asks, what if we keep social distance, but others around us don't? What can we do about that?
Yeah, that is a difficult one. I think most people probably have come in contact with that at some point. I know we have at home as well. And that's why we went with the education, because there are some people that don't fully get it right now. I guess my only advice to that is, depending on where it is and what the situation is, politely ask them to keep their distance. If it's kind of more of a repeat offence or a repeat person that's doing it, then, and you know who they are, then let us know, and we can provide that education. If it's a one-off, just nice, polite. I've done it. A lot of stores have got one-way systems on their aisles, and people don't often see them. So you just politely remind them that there's a reason for it being one way.
And what's the best way to report that? Would that be 311?
Yeah.
Okay, perfect. Okay, the next question kind of picks up on the hotspot stuff that you were talking about. Is the ask is, can you tell us some of those hotspots, where those hotspots are, so we can avoid them?
No, we can't really give out the hotspots. It's something that we're kind of still working on right now. We're trying to get a more accurate process right now in relation to them. I think, to be very general, most of them are larger green spaces and stairs.
Yeah.
The other big thing we're seeing now that people can educate their own families on is we are getting a lot of calls in relation to groups of, and I say people because sometimes it's youth, sometimes it's young adults playing basketball. And that could be anywhere from the schoolyards that are closed down, or because schools aren't in, to green space areas, or to just in front of people's own houses, but they're having 15 to 20 people playing basketball. Having been around basketball, I know you can't social distance if you're going to do it properly.
Okay, perfect. So the next question, I think, kind of builds, Vanya, I might need you to clarify it a little bit, is what about partners who do not live in the same household, partners or spouses? I'm assuming who have children, perhaps, that don't live in the same household. Vanya, I'm not quite sure I understand the question. Do you want to clarify it all for me? I'll just unmute you.
I was wondering about the partners. So some spouses don't live in the same household. So how is that treated when they are stopped if they are driving together?
Okay.
Yeah, I'm just trying to understand. So you're driving in you're not from the same household, but you're driving together for what purpose? Just for general.
So imagine I have a partner, like romantic partner, who doesn't live with me in the same house. So are we treated as the same household because of our relationship type, but we don't live on the same address?
That's an interesting question. Yeah.
Yeah, so I'm just writing something down. Yeah, it is. I'll get some clarity on that, but generally speaking, by the guidance that's out there, then, and I kind of have to go back to if you don't live in the same household and you're not going to the same place of work, you shouldn't be in a car together. But I will clarify that and the other one.
Yeah, that's a really good question. Thank you, Vanya. I've been thinking about that one. Okay, Kim has a question related to Barb's earlier. Because of language barriers and the length of time it has taken to get resources out in different languages and the lack of dissemination of them in accessible ways, different communities have differential access to information about the virus and measures to keep safe, and also the enforcement measures. How are language barriers being addressed with law enforcement?
In relation to the education, that all comes from Alberta Health Services. And like I say, they published in 13 languages. We are aware that there are communities out there that don't have necessarily the technology aspect to it. If it's kind of no different to normal policing. If we deal with someone that has a language barrier, we have access to translators. And as I said, our team's already used translator a few times to provide that education. There are people reaching out to other communities with this education as well.
How would one go about like asking for that interpretation service or support, do you think, Paul?
Well, ours is all internal if we need it. The resources that are done in different languages are all on the Alberta COVID site.
Okay, that helps. The next question from Carl is, how many calls is the report line getting?
Yeah, I can't give an exact number because I don't get to see them all. I can tell you that our team's been up and running for about 3 weeks now. And between ourselves and 311, we've investigated over 400. And they're all various. They're not one common theme, they're everything.
All right, this one is, I know that it might not be one that more difficult to answer, but I know there are conversations starting to happen about this. So this is from Robin. Is the EPS aware of any impending anti-quarantine protests like we're seeing in America? And is there a plan to address those prospective protests?
Yeah, I can't answer too much about that, but I can tell you that yes, plans for protests are being worked on at this time.
Yeah. And I think we're hoping that we'll be able to have more conversations about that one as we go forward, which is good.
Yeah.
But I don't know if there has been any murmurings of any happening yet, but thoughts on that. Okay.
None in Edmonton that I know of.
Okay. So I'm scrolling down here. Sorry, people are providing each other resources in the chat, which is really lovely.
Right.
Jessica asks, and maybe Jessica, I might need you to kind of clarify this as well. I'll just unmute you. Is how are the police dealing with cohort families?
Yeah, and what? Sorry, more.
Here she is. She's coming. Jessica, do you want to explain a bit more?
Yeah, so we're cohort families with the family next door. We've all been in isolation, but our kids still play together. We still help each other out. So if we have to go grocery shopping, we'll take turns watching each other's kids so we don't take them out.
Yeah.
We've seen other friends on Facebook where their neighbors have called the police on them.
Yeah.
Because they are all in the same house together. So between the two families, we're at 9. So we're still under the amount, but we are a bit worried about, should we be concerned about the police knocking on our doors one day and dealing with the trauma that could cause to, especially my child's terrified of the police.
Okay.
So is that something we should be concerned about, or can we still say, as Dr. Hinshaw hasn't said, you can't be cohorts anymore? Are we okay just to say we're cohort families if we ever get the knock on the door?
Okay. All I could say is that, generally speaking, those kind of complaints, where people, again, we've had them, where people call us in and say families are mixing. Generally speaking, they come to us and our team. And like I said earlier, we always start where possible with a phone call. So if we've got a phone number system, let's say for yourself, we would phone you, explain not who said what, but what was said. And then if you explain to us that you're cohort families, that would be an end to it.
Okay, great. And Carmen, just in response to the question about numbers of reporting, she just posted a link from the City of Edmonton about kind of what has happened. So the city is encouraging voluntary compliances and focusing on education, and found violating any orders will write tickets when appropriate. There have been 283 verbal warnings at dog parks, 50 at playground closures, and 28 vehicles for hire. So she just added that information. Next question is, has there been more enforcement, or have you seen any increase in enforcement, especially as the weather gets nicer outside? Because I have started to see more and more people outside as compared to before. So are you finding more enforcement these days?
We're not seeing an increase in it for sure. And an increase is difficult because if you're talking about COVID enforcement, then like I said, we've been spending our time with education. So eventually you'll have to see an increase, because as soon as you issue a ticket, it's an increase of one. But generally speaking, we're not seeing a mass enforcement like people are kind of, I guess, expected. But yes, we are seeing or our team is certainly seeing an increase in education and visits by either police or peace officers to areas that are causing concern, which obviously is seen by the figures that you just released.
Mm-hmm. Okay. All right, we're busy on here. Here comes the next one. This is from Beth. So how does EPS determine what constitutes observable symptoms, particularly when many people with COVID are asymptomatic? How is this different than carding, which we know targets BIPOC folks and people denied housing? So yeah, how does EPS determine what constitute observable symptoms? If you have any comments on that one?
Not quite sure. We have a series of questions we ask people.
Yeah.
When we deal with them to determine whether we need to protect ourselves to talk to them. So they look at all the stuff that's come out through Alberta Health Services. We follow the same
process
guidelines they give: fever, cough, sore throat, difficulty breathing, those kind of things. We ask people, have they been international travel in the last 14 days? Have they been in contact with anyone that they know is COVID? Have they had in close contact with anyone that's had any symptoms? So we ask all the relevant safety questions before we engage anyway.
Okay, perfect. Now, the question from Keely is around transportation again. So how are police dealing with people who don't drive and are using cabs or public transportation? Have we seen anything there at all?
I've not seen anything. At the end of the day, you can take a cab, but they have restrictions, and they're responsible for maintaining their guidelines. You can't sit in the front of a car for hire. They have to clean out after each person's been in. My understanding with the LRTs and the buses is they have the same procedures. They have seats taped off that you can't sit on to try and keep the social distancing. So if you're talking about social distancing complaints in relation to that, then no, we haven't, or I haven't seen many.
Yeah. And whether there's monitoring on public transportation. So we've got quite a few more questions. I think hopefully we can work through the rest of these, and we're coming up to the last 15 minutes. But this one is related to Vanya's question about the couples living in separate places. Single parents with kids, some folks with disabilities who don't live with their casual supports and are podding with other people to help support them. Are they subject to enforcement? For example, they don't live at the same address, but they're only seeing each other as per interpersonal agreement. Do you see any, is there any enforcement with that at all?
Are they talking about, if they're talking about support workers, that's kind of different, that's okay. To talk about other members of or other people, I'm not kind of quite getting that one, sorry.
Here, Kim, I'll just unmute you. Do you want to maybe explain a little bit more?
I think it was kind of clarified with the cohort question. But I guess just the casual agreements that people make to support each other at these times seem like sometimes they're against the law at this point. So I'm curious about, like, let's say I have a friend who is a single parent, and I have made an agreement to, I only see her, I live by myself, and I am, I do childcare with her kid. I give her a break, things like that. But it's not a formal caretaker agreement.
Mm-hmm.
Oh, right. Yeah, that from what you're saying does sound very much like the cohort. So yeah, with the cohort, if you're the two families or yourself and that family, they're all you interact with, then that's yeah, similar to the cohort.
Okay, and then, so this one is from Rob. Let's give it a try. It says, I'm a bit confused about the seemingly business as usual approach to community policing and engagement with marginalized communities, while at the same time, peace officers and police are been given expanded authority. Can you offer some insight into the conversations that you have with your colleagues about this? So I guess it's like, it seems like business is normal, but yet, and there is this expanded use, expanded, how do you describe it, authorities. Like, how are you negotiating that? What is the insight in your?
Yeah, we have the expanded authorities with the Health Act right now.
Mm-hmm.
But in relation to when I say business as normal, we're not using these to target people. We still educate the same. We understand that certain communities, like I said, don't have access necessarily to all the information online. So it's important that these people are given that education. And if that's done through the Expo Center or the other centers that are set up with the resources that are there, then that's how it's done. If we come across them on the street, again, depending on what it is and the interaction, we give them the same education. We understand there's times where there might be larger groups occurring. But again, the places that they occur around are being given the same education, how they can help to keep the social distancing aspect
Down. Which kind of connects to a next question, but I'm kind of gonna jump around a little bit to kind of find alignments. One question that kind of aligns with that is, so just to clarify, what can police do now that they could not do before?
The only difference is that the Public Health Act was introduced for those particular orders, and whilst that's in place, it just gives law enforcement, and it's not just police officers, it gives law enforcement enforcement powers under those acts. And when those acts are taken away by the government, then those go as well. Yeah,
very specifically the Health Act. So,
yeah.
Okay, so this is kind of starting to connect into education and stuff, but also the gathering thing, it seems to be the big thing. So a question is, there has been gaggles of teenagers hanging out in certain areas. Is that something police are aware of? Are they stationing people in places because they're finding it scary for the older folks when there's groups of them? So is there any kind of specific stuff happening to address the teenagers hanging out in places?
Not specifically in that respect, because they're teenagers or anything else. That is no different to any other groups that are hanging out. If the calls come in, then we investigate them. And like I said before, we are working on our hotspotting and mapping those for education to be done in those areas. So yeah, if we find out about them, they get added to our list. If we don't, then there's not much we can do.
Part of that hotspotting.
Yeah.
And so this kind of builds on that, is the question about, and this is from Nadira, what type of education are EPS officers giving to the public when they're out and about? How often is it, reviewed and updated, and how is that tracking? How is EPS tracking individuals who've received the education? What happens if there are multiple calls against one person?
Okay, Well, firstly, the education we're giving out is the education that's given to us by Alberta Health Services. It's the same education that you can read online. So, for instance, if there's a group of, let's say there's a group of 18 people and we go to it and they're there, they will be told basically that mass gatherings have to be under 15 and they'll be asked to leave. If it's social distancing, it's the same thing. They'll be told that the social distance is 2 meters. We do educate on what the potential enforcement can be, because people need to be aware as well. In relation to how we record it, if there is a warning given or an education given, yes, we will know who it's given to. It depends. It's not a blanket approach, so it depends. If it's a continual repeat event, a person who really just doesn't want to adhere to the education and is prepared to put people at risk, then we will go to enforcement. But as we stated, we'd rather educate. Education will change people's behaviours and will do what the acts were meant to do, and that's keep this pandemic down. And that's our main priority.
Is there a tracking of folks who maybe are kind of crossing the line a little bit much?
We keep records.
Yeah. Okay. So here's the next one, which kind of builds on, and this is interesting. This is more of a request for tips on how to handle a situation. So I don't want to waste police officers or peace officers' time. Do you have any suggestions for how to talk to my neighbors about these public health orders? I like my neighbors, but I don't want our conversations to feel like a threat. But I don't want them to be, I do want them to be safe. So, and this is one I've seen quite a bit actually, is like, how do I have a conversation with my neighbor or whatever about this stuff in a constructive way without it feeling like it's going to cause a conflict between two? Do you have any tips?
Yeah, I think with that, it is always difficult, especially as it is a neighbor. Clearly, the first thing is whatever conversation you're having with a neighbor has to be over 2 meters away. And I think it's more of a case of maybe if you could get into more of a discussion rather than a point finger kind of conversation. So maybe start with your normal general niceties, how they're doing everything else, and ask them if they have been keeping up with the news on this and what they know about it. And then once you're into that conversation, then you can do things like, I was reading the other day online about the social distancing and how you've got to keep this bit apart and how there is possible enforcement to it. I guess generally what I'm saying is try and have more of a conversation. Then I know, yeah, some people can get very, and I've seen this where neighbours get very pointy finger, and that we know that doesn't go down well.
Kind of opening it up gently with questions and stuff like that. So I think we've got about 2 more questions here, Paul, and then we'll kind of work towards wrapping it up. Kim asks, has there been an increase in the number of COVID unrelated charges and tickets in the past while due to increased COVID related enforcement? I think the question is, Kim, you can correct me if I'm wrong, is due to COVID enforcement and being out and doing this work, has there been an increase in other charges as a result of that?
I can't answer that. I don't know. So.
Okay, and he says thank you. And then Tina, this is a question I was thinking about this yesterday. So Tina, thanks for asking us. What is the intake on skate parks? Like, should they be avoided? My son's friend has been talking about going. Would it constitute social distancing if they're keeping their distance, or should they avoid it altogether? And can they skateboard on sidewalks as long as they keep their distance and follow in line with each other?
And I think that the key to that one is the social distancing. If you can, especially as the weather gets nicer, if you, and especially kids, can get out and exercise whatever way it is, whilst keeping your social distance, then there's no issues. With skate parks, the only thing you have to, I guess, be a bit not wary of. What you have to bear in mind with skate parks is, as long as your kids know that if more and more people keep turning up and it gets towards those numbers of 15, then they should be leaving. Okay. Or if they feel that, even if it's a small skate park and there's only 5 or 6 and that's not allowing the social distancing, then yeah, they should be leaving.
Okay, that's good. Kitty just had a question about where to access the video or transcript later, so I'll follow up with everybody who's been on this and share that information. And then just one thing, and maybe this is kind of more of a wrap up or thing to think about or something to follow up on, but some very good questions. I'm just not really clear about what powers do the police have that they did not have prior to COVID. What specific provisions of the Health Act are coming into force? Will any special provisions of the Health Act be reversed after this is over? So people are just feeling a little bit uncertain about what those powers are. So maybe just those 3 areas again, Paul, just reaffirming those would be good.
Yeah, I mean, I can't obviously talk about what happens after. My best advice with the Health Act is go onto the Alberta website. All the health acts and orders, they're all there. The ones that we are looking at, like I say, the social distancing, the mass gathering, the self-isolation are the ones we're looking at. And then Alberta Health Services are also looking at the mass gathering, and then they are dealing with the businesses. But as you can probably appreciate, any acts are lengthy, wordy, but they're all on that people can see what they are, and they can see what the enforcement and powers behind them relate to as well.
Okay. Yeah, so it's not, I kind of think about I realize you're British, so you might not but it's like maybe not the extent of like an emergency measures where, you know, police have authority to kind of do whatever. It's very clear on those kind of 3 areas, it sounds like, that you've been given. Okay, into those publics. Okay, so that was awesome. We made it through all of the questions. The only other question we have from Beth is, who can we reach out to in order to ask questions if we didn't have an answer? And I don't know if you have an answer, or Chelsea, if you want to answer that one, or who should we reach out to if we have any more questions?
You can reach out to me. You've got my email, Renee.
Okay, awesome. So what I'll do at the end of Chelsea, you want to say something? We're both unmuting you at the same time. I'll not touch it.
There we go.
Okay.
Yeah, I was just going to say, by all means, Renee, pass along my email as well if I can give any help. And I just wanted to also sincerely thank you, Renee, and John Humphrey Center and Paul for taking the time to do this today. This was a really great opportunity just to chat with everybody. And also I learned a lot. So thank you.
Yeah, well, thank you all for coming on today. And thank you for Paul for being on the not quite knowing what kind of questions were going to come your way. I mean, that's how it is in crisis. You know, we're all trying to maneuver this and innovate and communicate and be flexible. And I just really appreciate EPS being willing to have these conversations, because I think it's important as we move forward. So for those of you on the call, I will follow up with an email. I have some resources from Native Counseling Services that they wanted to distribute, and I'll share Paul's and Chelsea's email. And I'll also send, what I'll do is I'll send you this little recording, and then we're good to go. So with that, Paul, I want to thank you so much for taking the time, and Chelsea's team as well. And we are ending right on time.
Perfect.
Have a great day, everybody. The mass exodus. Yes. I'll just clear it out. So maybe if you want to have a quick. Just removing folks. Come on, folks. One by one. Carmen. How did you feel about that, Paul?
It was good. Yeah.
Nice meeting you. It went okay. It felt okay? Some of the questions were really hard to understand, but.
I think are you still recording it?
Oh, let's stop. Still learning all this stuff. Stop.
I know there's lots of learning. That's